Hi, I'm Leanne. I'm here with Dr. James Hubbard of thesurvivaldoctor.com, a popular blog where he writes about how to deal with medical problems during disasters and in the wilderness and any other time you can't get to expert medical help. He's also the author of the new book, Living Ready Pocket Manual First Aid. Hi, Dr. Hubbard.
Hi.
Today we're going to talk about H1N1, which is the flu strain that's going around right now and it's scaring a lot of people, and there's a lot of questions out there about it. So we asked Dr. Hubbard's fans on Facebook, the Survival Doctor page, and Twitter at SurvivalMD to ask any questions that they had about H1N1, and they had a lot of questions, so we're going to get to as many as we can today. So Dr. Hubbard, our first question comes from Sarah C. Robbins, and she asks, how is H1N1 different from normal flu bugs?
Well, in some ways it's different, in some ways it's not. Every year we have a different variant of the flu virus that goes around, or almost every year. Every year it changes. In 2009 we had H1N1, now we're having it again. Different strains of the flu, different variants of the flu virus cause different type of problems in people. Some hit you harder, some are more contagious, some cause more symptoms. H1N1 apparently for some reason hits younger adults and children and harder than some. It causes some really severe symptoms in a lot of people and complications, and it hits older people this year, which is pretty understandable for other reasons, such as they're just maybe weaker immune system. H1N1 seems to be putting more people in the hospital than a lot of these types of viruses, or flu viruses do. And there's reasons why it does that, but really the underlying basic reason is it's just the basic characteristics of that flu.
Okay, great. So it's just the flu, only a little bit worse for some people.
Yeah.
Yeah. Well, Holly Lasasso asks, what makes this flu feel different from any other strain? Would you know it if you got H1N1?
Not necessarily. Like there are every year, not only did the strains change, but there are several strains that are going around. So you may have H1N1, which is right now the prevalent strain, but there may be one or two other ones, or it could be a flu-like virus. Only about 20%, at the worst, 20% of the illnesses going around in the winter are from the actual flu, and others are, quote, flu-like viruses, which is another type of virus altogether. So this H1N1, it does have characteristics that make some people worse, but a lot of people are just going to have the regular old flu. Some people will have a mild flu with it.
If you think you have the flu, and maybe it's not the flu, it's the 80% of other things, how do you know if you have the flu or not? Is it a test? Is there a test?
There is a test. Usually it'll tell you in general if there is if a specific type of flu, but not a specific variant like H1N1. There may be that or not. But if you have the real full-blown flu and you have the test, then because of the side effect, the complications that are going around this year, it'd be a good idea to go to a doctor pretty quickly. And there are some antiviral medicines that do help decrease the symptoms if you catch the flu early and start taking them early. They do have side effects. You need to talk to your doctor about that. They're just like any other medications. Most people get along perfectly fine with them, and some don't. Great.
That was a question a lot of people asked, is what to do about the flu if you get it. Along the lines of the types of the flus, Jennifer Dexton Gutzman says she was just in the ER last week, and they said she had Influenza A. Is that the same as H1N1?
That's a variant. Influenza. In general, there's influenza A, B, and C. C usually doesn't causes mild symptoms. Usually A or B are going around. I can give some details on that. I will in some later post. Some of it is in my post that I already have up. But there's usually A or B, and then it even gets into other strains and variants, which H1N1 is one of those.
Okay, great. All right. Well, we're going to talk a couple of questions about the term swine flu. H1N1 is also called swine flu, as you may have heard before. And Linda Henshaw asked, why is it called the swine flu? Does it really come from pigs? And why does it cross over if it comes from pigs? And related to that, Lonnie Harrington asked, can you get it from other animals?
Yes and yes. But there are, but let me explain that. The flu there are flu viruses that affect only pigs, and there are flu viruses that affect only birds. And sometimes these mutate. As they grow fast, they change, they replicate, and they mutate. And sometimes they mutate with either another flu virus. Sometimes it's a flu virus that a human gives to a pig, and then those two get together and mutate. Occasionally, rarely, this mutation will develop into a flu virus that people can get. And then it has to do one more. It has to be able, sometimes the flu virus goes from pigs to people, and but not to people to people. But when it starts going to people, then that's what this, then you get something like H1N1. And H1N1 is known to have started in pigs and mutated into humans. Avian flu, or I think it's H5N1, I think that has shown some mutation from birds into humans, but not much from humans to humans so far. If it does, then it's going to be another big deal. But right now, it's mostly just for birds.
Okay, great. All right. Well, now we're going to move on to the flu shot, which we had a lot of questions about. We're going to try to stick specifically to H1N1 and the flu shot, how that relates to it. And I'm sorry if I mispronounce these names. Carlina Seep Gaither Johnson asks, once you have had the, let's forget about the flu shot and let's talk about immunity in general first. Once you've had H1N1, are you immune to it? She says, my 7-year-old now got it way back in 2009, and she was several months pregnant with her 4th child at that time, and I think she got it as well. Actually, I'm not sure.
If you have H1N1 and it's the same virus, then you're immune. You have the antibodies built up, you shouldn't get it again. If it becomes a different variant, if it mutates out into something else, you could get it again. And you could get other flu viruses that are going around.
Now, you say if it mutates out, would it still be called H1N1, or it would be called something?
Probably something else.
Okay. So
and right now, H1N1 is H1N1, and you should have a good immunity from it. I can't say 100% that you couldn't get it if you had it before, but you have antibodies built up, and you should be in good shape against H1N1.
Great. That'll make a lot of people feel better. Liddy Ballard Murphy says, for the flu shot this year, does this flu shot include H1N1 protection?
Yes.
Great.
Some people are saying it's not working so well. I don't know. So it could be hearsay. It could be right. I think you can't believe everything you hear and read on the internet on either way. So I don't know for sure, but I think H1N1 it is in this vaccine.
Okay, great. Paula Armand Brocato asks, is it too late to get the shot this year?
No, it's not. You have to take this into consideration, though. It takes a few days to an average really of 2 weeks to build up the most antibodies after you get the flu shot. So if you get the flu shot and you're exposed to the flu either that day or even the next or maybe even the next or so, you can still get the flu. So in 2 weeks though, you'll have some immunity, and the flu shot will still be working as well after 2 weeks as if you got it back in November or whatever.
And we still have a few months to go for the flu peak season. So,
yeah, we do.
Or at least a little while. So
yeah, we do.
Now we're going to talk a little bit about the flu shot effectiveness, because we got a lot of questions about that. And here's a representative one from Catherine Lawson. She asks, exactly how effective is the shot this year?
They never know that until after the flu season is over, or exactly. The initial estimates are it's pretty effective, but it depends again on if you get the flu shot and it's working before you're exposed to the flu. It depends on the person. Some people develop the antibodies for the flu, and some people don't from the shot. We don't know why. And even on a good year, it's nowhere close to 100%. I mean, it might be 70%, some on a great year, 90%. Last year was a bad year, 40%. And people who don't give or have a strong immune systems such elderly people get weaker immune systems with time. They did horrible last year on getting the flu shot. They're trying to find out exactly why and what they can do differently.
Catherine also asks, who should avoid immunization?
Well, if you've had a reaction to the flu shot in the past, avoid it. You can consider whether you want to take it or not. It's your decision. Your doctor can tell you specific cases. Certainly there are specific diseases where you shouldn't take it, and as far as allergic to eggs, there are flu shots now that are not made from eggs, and so you could see if you could find one of those. But again, those things are up to you and your doctor or whoever's giving you the flu shot.
Catherine Suzanne Rice asks, I heard that the H1N1 strain covered in this year's vaccination isn't always helping because there's a mutated strain going around. Have you heard anything about that? Is that accurate?
That's possible. The mutated strain going around, I have heard some things about a little different H1N1, and I don't know how much effect it would help, but it would probably help quite a bit with most people because it's so close to the H1N1 that it would help a lot of people that had it. But again, everybody that gets the flu shot, quite a few are going to get the flu.
So now we'll move on to the dangers of the flu. We just have a few questions about flu complications that might be of particular interest if you get the flu or if you have other diseases or chronic diseases already. So first of all, we have Rosa Crowley who asks, when you get the flu, what actually causes you to die when people die of it? Is it the flu or is it a complication?
Sometimes it's the flu, but most of the time it's a complication. You get the flu, and the flu, the virus, the upper respiratory virus, either gets down into your bloodstream or into your lungs, lower lungs. It either does that or it stresses your system so bad, your system fight it off so bad that you get you're prone to a bacterial infection, which then you get like pneumonia or something similar to that. That's why people with already chronic problems need to be especially careful when they get the flu, because they have a more of a tendency, say if you have a lung disease, you're going to have more of a tendency to get pneumonia. If you have heart problems and you already have you're already stressing your heart to the max just to live, and then you put all this extra stress from this illness on there, you can die from that. H1N1 is kind of infamous for the cytokine storm that it can produce in young people. That type of storm, it can kill you fast. It can happen for multiple reasons, not just the flu, but H1N1 seems to be one of the causes where you get the flu, your body's immune system all of a sudden just goes haywire and starts producing all sorts of types of inflammation and swelling and things that can kill you within a few hours. It's hard to treat, and you usually end up in the hospital, and some people survive and some people don't.
Well, so you're saying that tends to strike young people who probably would think they're fine with the flu?
Yeah, it strikes all of a sudden. I don't know that you have any real prediction or who's going to get it. It's certainly not something that the majority of people are going to get, but it does happen, and certainly it's serious and heartbreaking, and right now we don't know too much how to prevent it or how to actually predict it.
So basically, if you're worried,
if you have a bad case of the flu this year, especially with the H1N1 going around, my suggestion is you go to the doctor and get the antivirals, or at least go, if you start really getting sick, don't wait very long. I mean, if you start getting short of breath or can't eat or severe headache or confusion or something like that, get to the doctor right away.
Great tip. Sue Cypria asks, I skipped the flu shot and found out I'm pregnant. Congratulations. Now, why is it so dangerous for me? Why is the flu H1N1 so dangerous for me? And how long is the greater public not as safe to be around? She wonders, can she get out of the house?
Talk to your obstetrician about the flu shot first off. I'm not sure exactly what, but I do think that I don't know what the cutoff date is, but a lot of pregnant women can get the flu shot, number one.
Oh, yeah, I think I said, why is the flu shot dangerous for me? I don't know. Anyway, the flu, yeah.
If the flu is maybe somewhat more dangerous for pregnant women, but it's also the fetus you have to worry about, because the fetus is still growing and still that high fever and that stress and everything is likely to possibly give some complications there. As far as how long stay in, you stay in as best you can, away from people, especially in big crowds. You wash your hands very, very frequently. If you consider wearing a N95 type mask to keep away viruses and that sort of thing.
N95 mask is like a step up from the
it has tiny little holes small enough that it can keep out a lot of viruses.
You said wash your hands. Can the flu spread through the air as well?
Flu spreads through the air and through somebody touching their nose or mouth or anything, or sneezing and catching or whatever, shaking hands or common contact with a doorknob or something like that. Then this person who does that, the healthy person, does the same thing, and they've got the flu. A tremendous amount of flu could be prevented by just staying away from people who have the flu, obviously, and washing your hands frequently.
Great, okay. Brian Keith George, and you kind of addressed this already, so just see if there's anything else you want to say about it. He asks, are people with heart issues such as aortic valve replacement or any open heart surgery at any greater risk this year?
I think anybody with any medical problems is at more risk for a lot of different reasons, including the stress, the possibility of bacteria, secondary bacterial infection. So I think anybody should check with their doctor about that. And as far as are they at more risk this year than any other year, I'm not sure, not that I know of.
We're going to end with one more question on this topic, and then we're going to throw in a couple of bonus questions for you preppers out there. Dr. Hubbard, I know you get a lot of readers who are preppers, survivalists. They call themselves different things, but basically people who prepare for disasters and major events. So we have a couple questions that come from you guys. They're for you guys. But before that, we're going to ask one more question from Shelley Ritter-Giese. She says, after she was prescribed antiviral Tamiflu and steroids, she's starting to feel better. Very good. 5th day now. She's on oxygen 24/7. She says it is a very horrific flu. We heard that from a lot of people, by the way, saying that it's the worst flu they ever had. Her question is, can you still get a bacterial infection even though you're on an antiviral, Tamiflu? She says she feels like a lung infection might be close.
Definitely. Antiviral is for viruses, specifically for the flu and some other types of viruses. Bacterial infection, antibiotics are for that. They don't take care of viruses. That's one of the major problems with the flu, other than being sick for a week and in the bed and things, is the complication of secondary infections. And so some people get it while they have the flu, some people start getting better, and then all of a sudden they start getting worse, spike of fever, get short of breath, whatever, bad sore throat, earache, bad headache, and that's a good sign that you might have a secondary infection. So, and you need to go to the doctor and get checked and see if you need some antibiotics.
Great. Antibiotics different from antivirals. Antibiotics for bacteria.
Definitely.
All right, so let's go on to the preppers. A couple of prepper questions. Jason Hampton asks, he says this is an overkill prepper question. He says, if a major outbreak occurs, how long, hypothetically, could we expect it to maintain its potency, its virility? Should you expect to avoid stores and public places for months?
It depends upon what we're talking about. The type of virus. If we're talking about something that he's talking about here that's going to cause that much problem, then most people are probably not going to be immune to that or even have antibodies against it, so they're going to be very, very susceptible to it. The only thing you could do is wait and see. There's probably going to be a peak, and then people are going to get better. What was the second part of the question?
He says, yeah, how long could we expect it to maintain its potency? And should you expect to avoid public places for months?
Probably not for months, but it is possible. It just, again, depends upon the infection. Different types of some infections are going to hit hard and fast, and some are going to be chronic and linger. Most viral infections, if you have one specific type of infection and you live through it, then you're immune to it. Sooner or later, everybody's either going to be sick in the bed, or have had it and over it, or have died. So how long that's going to take? It could be a few weeks. It could be possibly could be a few months, I suppose.
Okay. And finally, Lime Green Medic asks, how should we handle an influenza infection under austere survival conditions where there's no infrastructure to transport to? Basically, you're after a disaster or something and you can't get to a hospital. Are there curative options, or are we restricted to quarantine and palliative care?
Well, and this is, I think anybody should know these prepper questions are good for everybody, and yes, the other questions are good for preppers. It doesn't matter. But what you should, there is no specific cure for the flu virus. In fact, very few viruses there are. If you had an antiviral on hand and you had it, you would take it. Otherwise, you're going to have to do the usual things, which you probably want to do anyway, which is rest and drink fluids. Very important to do those two things so your body's working efficiently and producing antibodies and other types of ways to fight off that flu. You're going to have to give it some time, and it'll probably be a week or two. And if you have, you have your favorite type of whatever to take, herb or whatever, or essential oils or any of those things, then those are great to take for then. They're not going to cure the flu, but unless, and certainly know what you're taking so you don't harm yourself. Any of those things like that could be, are medications. If they affect the body, they can also adversely affect the body, so know what you're taking. You could be allergic to it, it could give you some sort of infection, complication, or it could interact with medication you're already taking. But there are multiple herbs and essential oils out there that you can take. I also, on my website, have some proven of those types of things that help the colds and right, either treat it or prevent it. Vitamin D is a good thing for prevention. People are it's probably overhyped to a certain degree, but if you have a deficiency, your immune system is probably not working as well as it could with regular, if it were normal. After you get the flu, there's been no real showing that it helps very much, and I have a lot of those things on my website.
Great. Okay. And as Dr. Hubbard said, all these questions are great for everybody, and he hopes everybody's a prepper and a survivalist at thesurvivaldoctor.com, because you never know what might happen. So thank you guys so much for all the great questions. Go to thesurvivaldoctor.com for answers to more of your questions, especially general ones about the flu and the flu shot. Thank you very much, Dr. Hubbard.
You're welcome.